Hello, this video is to show you how to use super wraps. These are 3-inch super wraps made by Fabrifoam to facilitate rotation in a segment of the leg. So we're going to take our 3-inch super wrap and start at the end that has no Velcro on it, and then I'm going to have my patient bend his knee and point it out to the side. This is facilitating lateral rotation. So I'll start it on the inside of his thigh, doing one strip around just to anchor it, and then every wrap around is about 10% tension. And then I'm going to anchor it around his waist, around actually his pelvis, not up by his belly, around both sides of ASIS. And he's just little enough that he can have one wrap, but they can attach to each other. So one Velcro can attach to the next super wrap, and then you can go from there for a larger child or an adult if you're trying to see how this will work. So this sort of gives you the idea of what adding lateral femoral rotation will do to their gait or to their knee pain or to their knee control and standing if they're doing a single leg mini squat. So this comes in handy. You can also facilitate medial rotation with these wraps. Now the way that you know if your wrap has helped your patient with the lateral rotation way that you did it is you look at their alignment of their kneecap when it is on. It doesn't really affect tib fib. Some kids will correct all the way, but if they're still in toeing or you still see some medial rotation at the lower segment of the leg, then that's okay. It's all about their knee alignment. So if you added a wrap for lateral femoral rotation here, you would expect that the wrapped knee would be a little bit more on the frontal plane or perhaps laterally rotated from the frontal plane when you have it on. So if you want to do medial rotation, it's just the opposite. So I would start behind their knee here, maybe have their foot and then turn their knee in and their foot goes inward. That's their starting position. And then I wrap inward like this. And then I would just go across the front of their body like so and anchor here and then let it go. It's not as frequent to go medial, but you totally can.
Okay.
There's one more thing I'll show you how to do with the super wraps, and that is wrapping medial and lateral tibial or tib fib segment rotation. So it's the same way. Basically, you position the segment in the position that you want to facilitate. So in this case, it's medial tib fib rotation, and I can see you can't quite see this on the screen, but there's nothing special to it. It's just a circumferential wrap with 10% stretch. This is the way that I also recommend to add compression if you want to see the effect of extra proprioception on a toe walker. So he's just wrapped here to here, and the starting position was with his foot turned inward just a little bit. You can also do the same technique and correct his foot and tib fib segment laterally, and that's where the starting position would be. So that is super wrap. And you can buy the 2-inch, 3-inch, and other size of super wrap on Fabrifoam.com. And I believe
the link is in the description.
No, it's actually not in the description. And I believe if you are a therapist, you can call Fabrifoam and tell them that, and the discount they will offer for a provider. So thank you. Give me 5.
Hello, YouTube.